Welcome back to Saturday AM. Now, menopause is something that every woman will go through, but that doesn't mean each woman will have the same experience. During menopause, women go through a variety of both physical and emotional symptoms.
Now, for some women, the menopause is a very unsettling period in a woman's life. However, other women go through it with almost no problems. Joining us now to tell us more and to answer some of your questions is Dr. Shirley McQuade, Medical Director of the Dublin Well Women Centre. Shirley, you're very, very welcome.
Good morning, Shirley.
Good morning.
Thank you for joining us.
Yeah, now, of course, a lot of women are wondering, and at home, even including myself, what is the menopause?
Really, the menopause really happens because the ovaries stop producing estrogen. So ovaries help with menstrual cycle every month. So when the menstrual cycle becomes irregular, it's often because the ovaries are slowing down. So when the ovaries have slowed down to the point where they're no longer able to control the cycle, that's when menopause happens.
Mm-hmm. And what age would women be affected by the menopause, and how long can the menopause last?
Well, those are two interesting questions because the age at menopause is usually between 45 and 55. We get some people who have menopause much earlier than that. The youngest person I've seen was 28.
My goodness.
While we still have some women going on strong, having cycles until they're 54, 55.
Right, OK.
So there's a huge difference, variation. And then as far as menopause symptoms go, there's huge variety of what people get in the way of symptoms as well.
Lisa mentioned that in the introduction, and I suppose they're unique and specific to each woman, but there are some generic symptoms that you can perhaps be mindful of. Sure. Because I would imagine some of these symptoms, we were chatting about it yesterday in the office, you wouldn't necessarily think menopause. You know, we've got the symptoms here. A lot of times we've been affected by, you know, our moods, our irritability, perhaps not hot flushes, but can you explain a few of those symptoms to us?
The most common ones would be hot flushes and night sweats, and they would affect probably 70–80% of women. Most of the time they're manageable, so someone doesn't need to have any treatment for them, but they're just aware that something's happening. But there are other symptoms which are kind of quite common, but people don't realise they're due to the menopause. So things like chest pain, heart palpitations,
that's a big one.
Sleep disruption, aches and pains in your bones. Oftentimes women have come to me because they've been to a cardiologist because of the chest pain. They've been to rheumatologists because of their aches and pains. They may have been suggested to go on antidepressants because their mood swings. And all of that is menopause.
Now, a friend of my mother's who actually came up by teacher in the week was explaining about the hot flushes, and we were speaking about that these can come on at any stage throughout the day or even at the night time. How do you manage that at work or with family or with friends?
It's quite difficult because I see lots of women who work in offices and they're in closed offices where they don't have access to opening a window, for example. So what they need to do is layer up so that they have, you know, a T-shirt and a cardigan and something else on, and then they can take those off as the day goes on if they feel a little bit hot. There are some things that you do, though, can make things worse as well, like caffeine is something that can set off hot flushes. So caffeine and alcohol would be and spicy foods as well. So to avoid those if you're having trouble.
Shirley, what's the reason behind the hot flushes? Is it a hormonal deficiency of some sort?
It seems to be a problem with the regulation, a thermostat regulation. So the temperature regulation is off.
Well, temperature regulation is off anyway, you know, month by month for women. So we'd be used to having, you know, a couple of symptoms midway through our cycle.
So no one knows really the origins of how the hot flush, or Americans call it flashes.
Flashes, that's right, they do, don't
and
they?
some people don't get flushes or flashes, they get tingling in their hands and feet. And I've had some patients come in who have something like electric shocks going through their system. And that's a form of hot flush as well.
So in terms of alleviating these symptoms, because there's no cure for menopause, we're all going to go through it, but in terms of alleviating, what can we do naturally? And then we'll talk about HRT in a minute.
So the natural things really would be not taking too much caffeine, reducing your caffeine intake, reducing alcohol, trying to have a reasonably good diet and lots of exercise.
I saw that you put in there fresh fruit and vegetables, and I know...
processed foods and takeaways and all of that. You don't know what's going into those, so you're much better off to cook for yourself.
Good, OK, that's great. All right.
And in terms of HRT, so this is a hormone replacement therapy, so it's in tablet form. What are the benefits, and what is it, first of all? How can it benefit us?
Firstly, it depends on the woman. There are I suppose the difference between women who have a womb and those who haven't, there's a difference there. Women who have had a hysterectomy only need estrogen, whereas women who still have their womb will need, and that's the vast majority of women, will need to have progesterone as well as estrogen. So the estrogen bit is the bit that controls the hot flushes and the night sweats and the aches and pains in the bones and helps with sleep. Progesterone protects the lining of the womb. There are tablet versions and there are patches and there are also gels that people can use. So it depends on the patient, on the woman, her family history, her personal history, whether she's at risk of blood clots. I would not put someone at risk of blood clots on tablet estrogen, but I would put them on patches because that's safe. There are differences in the age that the woman goes through the menopause at as well. So if you've got someone who is much younger going through the menopause, they probably are safe on tablets, whereas if you get someone in their mid-50s, we're looking at patches. So it varies from person to person.
Shirley, would it be okay if we spoke about people going through cancer treatment, radiation and chemotherapy? Because there's a lot of women our age, older, pre and post menopause, that have to do these treatments for weeks on end, sometimes years on end. So how does that affect the menopause?
So that can be quite difficult because if the chemotherapy or radiation affects the ovaries will stop working. And so those women will be thrown into an early menopause. And it depends then what the reason for their chemo or radiation is as to whether or not it's safe for them to use HRT.
Okay.
In some instances it is. In instances, and that would be something I would talk to the oncologist that is dealing with them. In some instances it's not safe, in which case there are non-hormonal medications that can be used to help alleviate things as well.
Okay. But best to obviously defer to your doctor.
Talk to the oncologist about that as well.
That's a tricky one. Yeah.
We've had loads of questions from our viewers this morning. We're not going to get time to go through all of them, but there was an interesting question from Susan who texted in from Louth. I'm currently going through the menopause. My doctor and friends have told me that I need to relax more. I'm finding it really hard. I'm wondering if you have any tips that would help me. So stress obviously has an effect as well.
Yeah. Stress does, and I suppose exercise is a really good way of relieving stress. But really to do a little bit of an audit on yourself and look at home life, work life, financial stresses and relationships, and really look at all those areas and see if there are things that you can do. For example, at home, bring everybody in the house on board, tell them you're having problems, get them involved in doing the housework and all of that. That will help. At work, just looking at, do you really need to do all the things you're doing? Do you need to take your work home with you? Don't do that if you don't need to. Sure. All of those things make a difference.
And look after yourself.
Just really looking after yourself.
Exactly. Yeah. Thank you.
Thank you very much for explaining that this morning to us, Shirley.